So when I'm doing accelerated resolution therapy with my clients, a lot of the times I'll do the traditional eye movement with a light bar or my fingers, but a lot of clients struggle with visual things, or their eyes get tired or they get migraines, and so they want to use something else. And I'm so glad I have the tappers available. And in fact, most of my clients actually prefer using the tappers because they like to close their eyes. And there are sometimes it's not appropriate for them to close their eyes while we're doing the reprocessing. But most of the time, it's so effective for them to be able to hold on to those. And I'll just go through and we'll reprocess the memory scenes, which usually lasts around 45 seconds. And then they'll come back and then we'll talk through that and then go on through the protocols. But in a typical session of using ART, accelerated resolution therapy, I may end up doing in the neighborhood of 20 to 30 processing moments with them of like 30 to 45 seconds a piece using the tappers. And so I'm using them quite a bit inside the session. And it's nice to have the remote on my phone where I can just turn them on, turn them off. And I allow the clients to decide what intensity and what speed they want. I try and get the speed on it as quickly as possible because we try and mimic the eye movements that we do in ART, which are a little bit faster. And the structure of the sessions usually follows the client remembering the memory scene, and then we work through and help them try and get to a place where, as they recall it and remember it, that they retain the memories of it, but they lose all the sensations and distress with it. And the tappers make a huge difference in doing those bilateral movements with the client as they process through their memories.